So, hello and welcome to Health and Protection. I'm joined today by Stuart Scullion, the Executive Chairman of the Association of Medical Insurers and Intermediaries, who's going to share some of his thoughts on 2020 and what might lie ahead in 2021. Stuart, thank you very much for joining us. I know it's a big question, but how was 2020 for you?
Probably different personally than professionally. I think 2020 has undoubtedly been tough. I think the industry's responded sort of manfully to the challenges, particularly in the way that they came at them. I think they've adopted and adapted to new ways of working. And again, we all know that come the 23rd of March, overnight, 70% of the working population were either working from home or furloughed. I think the insurers have done well. They adapted their T&Cs where there may have been pandemic exclusions, and they enhanced their NHS cash benefits to support those who had been hospitalised with COVID. So I think that was all really positive. I think the one thing that I would say is that digital technology, in my view, has probably leapt forward sort of 5 years overnight, not least in the delivery of private GP services and appointments. And I think that has been positive relative to COVID. I think that as a nation, we tend to be sort of slow adopters, but circumstances meant that we've adopted digital technology for healthcare fairly swiftly. I think one of the other challenges for us in 2020 has been the impact of musculoskeletal conditions, which have clearly come to more prominence as people have been working from home, from beds, beanbags, settees. One of the positives I've seen is I think that UK PLC, we've been much more active in terms of our exercise. We all see cyclists and runners and dog walkers out all the time. And I think that's been good for our physical health, but clearly it's been a contributor towards our mental health, which has been a problem. And I don't think we necessarily anticipated how big a strain COVID and home working and the way we're having to work would put on people's mental health. I think the insurers have done